CNN, a traveler isolated for COVID-19 at a quarantine facility in New Zealand managed to infect 3 others across a hallway, researchers reported Thursday. Closed-circuit camera footage, genetic testing and careful contact tracing show that the only conceivable way the virus could have passed from one room to another was in air that leaked out when both doors were briefly opened, the researchers said. It's a demonstration of how the virus can spread, and of how well vaccines can work. The one person who escaped infection was fully vaccinated and never tested positive, despite having stayed in the same room as 4 other infected people for weeks on end. Both sets of travelers arrived in New Zealand in mid-July, as the Delta variant of the coronavirus was sweeping the world. One single traveler from the Philippines tested positive during quarantine and was placed into a converted hotel called a managed isolation facility. A group of 5 people traveling from the United Arab Emirates also arrived, were quarantined, and then one member of a group tested positive, so they were placed in the same facility, across the corridor from the first traveler. No one was allowed to leave either room, and the doors were opened only for nurse checks and food deliveries, but the doors were not supposed to be opened at the same time. Nonetheless, it did happen, according to Andrew Fox-Lewis of the county's Manukau District Health Board in Auckland, New Zealand, and colleagues. Security camera footage revealed 4 brief episodes of simultaneous door opening during person A's infectious period, the team wrote. Each time lasted just a few seconds. 3 more people in the group of 5 became infected, but genetic testing indicated that their infected companion was not the source. It was the traveler from the Philippines. Their virus had the same genetic fingerprints. Airborne transmission across the hallway is the most plausible explanation, the researchers said. These findings are of global importance for coronavirus disease public health interventions and infection control practices, Fox-Lewis and colleagues wrote in the journal Emerging Infectious Diseases. Person A was found to have not left the room at any point during their infectious period, and it's possible that this traveler breathed infectious virus into the air of their room, and the air puffed out into and across the hallway when the door was open.